So I'm Dr. Waples from Restor Medical Spa, and welcome to part 2 of our 4-part series on the aging process. Just to recap very quickly, the aging process is not one monolithic thing that's happening to a person. There are multiple different processes that are happening in different parts of the face and moving at different speeds in different individuals depending on your genetics and how much time you spend in the sun and that sort of thing. But there are 4 separate processes that are going on, and in order to understand the full aging process and how it works and what you can do about it, it's good to understand kind of the background of what's going on in your skin and in your face at any given time. So the 4 parts of the aging process are 1, dynamic wrinkles, which are caused by muscular contraction and generally speaking form the deep creases and furrows of the upper face. 2, loss of volume, which again generally speaking occurs in the lower face or the mid and lower face. 3, intrinsic skin aging, which is just the wear and tear on your skin that life creates, which occurs anywhere that you have skin. And then 4, skin laxity, which is just the looseness and the sagging that you start to get in your skin secondary to gravity, and just gravity's effects, which happens primarily underneath the eyes, in the jowls and neck. And then, of course, some other parts of the body, your breast, the stomach, of course, those things can happen. But right now, we're going to be talking about loss of volume in the mid-face and how it affects the rest of the face in the aging process. So, as we age, we begin to accumulate hollowness and creasing in our lower face. And the most common things that you see is some hollowness underneath the eyes, these lines here along the sides of the nose, called the nasolabial fold in medical terminology, but the lines here, lines around the sides of the mouth. And the urge, so the natural response is to look at the face of somebody who's experiencing some aging, someone in their 40s or 50s or 60s, and to go, okay, well, you've got creasing here, you've got creasing here, this is the problem. The problem is where you're having the wrinkles. And that's actually not what's happening. What's happening is a little bit more complicated than that. So I'm going to show you a couple of pictures so you can get an idea of what's going on underneath the skin. Now, if you can see this, this is a sort of cartoon description of what's happening along the mid-face as we age. So you can see over here in this image, somebody who's young. This is a picture of somebody who's probably about in their 20s. You can see this wonderful Nike swoosh shape of tissue sitting on the cheekbone. It's called the malar fat pad. And the job of this soft tissue, it's fat and collagen and some connective tissue, but its job basically is to be a scaffold upon which the whole lower face hangs. And as we age, it starts to break down. This really starts happening kind of in the 30s, in the mid-30s, and then moving onward. It starts to get thinner, flatter, and it also slides forward off the cheekbone. So you can see here exactly what you see in the aging faces of people around you, is you see hollowness underneath the eyes because this tissue that's supposed to be sitting up here and filling up that area is gone. And it's sliding down off the cheekbone and it's creating this crease right here. So this is a very common thing you see, hollowness under the eyes, creasing here, and then creasing down around the mouth. This is not caused primarily by the malar fat pad. This is more because we use this area of our face quite a bit when we're speaking, when we're chewing, when we're making expressions. This tissue right in the corners of the mouth starts to break down just because of the wear and tear that it sees, and so you start to get lines down here as well. So I'm going to show you another picture to give you an idea of what this looks like in a real human as opposed to a cartoon. This is a picture of my mom, who is actually several years older in this picture than she is in this picture. So in the before picture, you can see exactly what you would see in that cartoon. You see hollowing underneath the eyes, here and here, right? You can see this tissue here is supposed to be sitting up here and protecting the orbital bone and filling in this hollowness around the eyes, but instead it's slipped down off the cheekbone, sitting here, and it's creating that nasolabial fold. You can also see that she's got some lines around the corners of the mouth, which are caused, again, just by wear and tear on the collagen here at the corners of the mouth, creating those marionette lines down at the bottom. So what we did is really pretty straightforward. Once you understand the cause of these lines, the treatment is very straightforward. You take fillers, which are made of bioidentical molecules, which are safe underneath the skin, and we basically injected filler up across her cheekbones and recreated that natural appearance of the cheekbone and the malar fat pad, filling in this hollowness, lifting this tissue up, lifting this tissue up. So what you get is a very, very natural, very refreshed, very appropriate kind of look that really addresses the root cause of that aging. And if you want to learn more about dermal fillers and their use in the anti-aging work, you can look at our other videos on dermal fillers and aging of the mid-face.